welcome to the second part in the cCMV training series. Today, we will be providing guidance on how to best implement cCMV screening in your facility. As we previously mentioned, we will have a third training in August of 2020 to discuss in detail guidance on reporting to VDH. Today, we will be discussing an overview of birthing hospital responsibilities as outlined in our hearing-targeted cCMV screening protocols. We will review our VDH responsibilities regarding cCMV screening, discuss in detail cCMV sample collection, preparation, and transport to the state lab, DCLS, provide an overview of materials that will be provided to facilities in order to conduct cCMV screening, and end with a list of next steps for all facilities to consider prior to implementation of cCMV. Some of the birthing hospital responsibilities include designating at minimum 2 hospital employees to serve as point of contact for VDH regarding cCMV screening. Develop methods to collect and record all required data into visits, the Virginia Infant Screening Infant Tracking System. Ensure all screening personnel are appropriately trained to conduct cCMV screening. Additionally, hospitals should provide to families written information on cCMV screening and recommendation for next steps, for example, using VDH-provided materials, which we will discuss later. Communicate to the PCP that a cCMV screening was conducted and provide hearing screening results. Report to VDH within 7 days of discharge. However, best practice suggests reporting within 48 to 72 hours of discharge. Some of the responsibilities that will be carried out by VDH include providing education on cCMV prevention and next steps after diagnosis to the general public, mainly women of childbearing age. Virginia EDI will contact the parent or guardian for children who are screened for cCMV and children who test positive for cCMV and provide recommendations for next steps. Virginia EDI will also contact the PCP to inform them of children who test positive on cCMV screening and discuss next steps. At this time, we will hear more information regarding sample collection, preparation, and transport to DCLS from Liema Lyon, the newborn screening manager.
Hi, my name is Liema Lyon, and I'm one of the newborn screening group managers at DCLS, the State Public Health and Environmental Lab in Virginia. We're excited to be bringing up congenital cytomegalovirus testing this fall, and I wanted to take the opportunity today to talk to you about the tests that we'll perform, as well as the sampling procedure and transport logistics. Before we dig into those specifics, though, I want to share a little bit about our program in case you aren't familiar with it. Virginia's newborn screening program is a partnership between DCLS and the Virginia Department of Health. We currently screen each baby born in Virginia for 31 rare yet serious metabolic and genetic disorders. Newborn screening was first mandated in Virginia in 1966, and it's required by law for all babies that are born in the Commonwealth. 5 drops of blood taken from a baby's heel allow scientists to check for disorders that range from the well-known cystic fibrosis to the relatively obscure maple syrup urine disease. The effects of these disorders and others can be treated, and problems can be prevented if they're detected early. We receive about 120,000 samples and perform more than 4 million screening tests each year. We operate 7 days a week, including holidays, and we provide screening for all time-sensitive disorders every day to ensure timely reporting and follow-up of results. To make sure that the samples arrive quickly and safely, DCLS provides a courier service to pick up samples from hospitals and birthing centers overnight throughout the state. Virginia Department of Health's newborn screening staff follows up on the abnormal test results for more than 20,000 infants each year, making sure that babies with the most critical test results are referred to the specialty care that they need. We can perform repeat tests on infants up to 6 months of age. Okay, now we're on to the cCMV, which is the short version of congenital cytomegalovirus. Onto those specifics. We're mandated as part of the Code of Virginia to begin cCMV testing on September 1st, 2020. We estimate that we'll test approximately 3,800 samples each year based on the number of babies that failed the first hearing screen in 2018. The cost per test is approximately $60. However, that cost is spread across all the babies born in Virginia, and it's included in the collection device fee. So the upfront screening fee that each baby pays will cover this testing, whether that particular baby needs this testing or not. No additional funds will need to be collected from the hospital or the parents. So it takes about $2 of that total $137 collection device fee to cover this test for all the babies that need it. DCLS is using the Meridian Bioscience Alethea platform for cCMV testing. The Alethea test is FDA cleared and it's designed to be run on a saliva sample. The test uses loop-mediated DNA amplification, which we call LAMP technology. It's a little bit complicated, but essentially it's looking at 194 base pair region of the cCMV genome, and it generates many, many copies of that target. During that amplification, a cloudy precipitate is formed, which makes the solution turbid, and it's that turbidity that's formed in the presence of the CMV DNA that the instrument detects and translates into a positive test result. Okay, so on to the sampling details. DCLS will provide the kit components to you free of charge. We're going to provide flopped swabs and viral transport media, or VTM. We'll provide a biohazard bag that will contain the sample during transport, and we'll provide a submission form, cooler, and ice packs. It is really critical that these samples remain cold from the time of collection until the time of testing. That's going to be our biggest challenge. We realize it's going to be a challenge for you all too, and we hope that hearing this information now will help provide the time to think through the logistics on your end as well as ours. One other challenge that we're trying to overcome right now is the lack of availability of swabs and VTM due to COVID testing. We're hopeful that we'll be able to secure the supplies that we need to start the testing on September 1st. However, we realize that swab and VTM availability may have to delay the start of this test. Should that happen, we will of course be back in contact with you. We have instructions that will come with the kits, but just to review the protocol today, what we're going to need is a saliva sample taken with a swab and placed in a transport tube that contains 1 ml of VTM. It's very important that the swab be placed in the VTM and that there only be 1 ml of VTM in the tube. Dry swabs don't maintain the integrity of the sample as well, and more than 1 ml of VTM will dilute the sample and may lead to a false negative result. It's also important that only the swabs that we provide for this test are used. While we understand that hospitals have many swab types available, this test is only validated for the swabs that we provide. Other swabs may inhibit the test and invalidate the FDA clearance. One other important note about the method is that you'll need to wait at least 1 hour after the baby consumes breast milk before swabbing. Breast milk may contain CMV, and we won't be able to differentiate whether the infection is in the mother or the baby. Okay, so to walk through the testing, you'll start with making sure that you have all of your materials and that you've waited that 1 hour after the baby consumes breast milk. Then you'll wash your hands and/or put gloves on. Carefully open the sterile flocked swab and remove it from the transport tube. You want to place the swab between the baby's cheek and gum and swab gently, making sure that the swab remains in contact with the gum for 10 to 15 seconds. Then go ahead and move the swab to the other side of the baby's mouth and repeat, allowing the swab again to remain between the cheek and gum for 10 to 15 seconds. Please check to be sure that the swab appears moist once it's removed from the baby's mouth. And also check to be sure that the tube is labeled correctly. Then place the swab in the tube for storage and transport. But please don't forget to place the tube containing the swab in the refrigerator at 2 to 8 degrees Celsius. Again, it's really critical that the swab placed back in the VTM gets into the refrigerator promptly. Failure to hold the sample at a refrigerated temperature until testing will lead to false negative results. The sample should be sent to DCLS on the courier, which visits each hospital each evening. There shouldn't be a reason to batch sample shipments since the courier comes each night. It will be important to make sure that the courier gets the cooler with the specimens when they pick up the newborn screening cards. This is again something each hospital will need to develop their own system for, as we realize the refrigerator may not be in the same room where the courier picks up the cards. So please think through those logistics between now and September. A completed sample submission form, which we will provide to you, will also need to be included with each sample. So to prepare the samples for shipment on the courier, you'll place the swab, which is already in a tube containing VTM, in the biohazard bag provided with the kit. The bag should be sealed by removing the adhesive strip and pressing the seal to the bag. Then the completed submission form is placed in the pocket on the front of the bag, and the bag is placed on frozen ice packs in the cooler. The cooler will be labeled when you receive it, such that the courier is aware of what belongs in the cooler and where to deliver the cooler when it arrives at DCLS. Once the cooler is packed, you'll move it to the courier pickup area and hopefully check on it periodically. Things happen. The courier might run late or not show up, and we want to make sure that the integrity of the sample is maintained. So please be sure that the cooler was picked up, and if not, place the swab back in the refrigerator until the situation can be resolved. We're going to provide you with 3 coolers and ice packs to get started. This will allow one to be in transport to DCLS, one to be in transport from DCLS back to you, and one to be in the hospital at all times. If you need more, just let us know. It's important that you use the cooler that we provide, as it will be appropriately marked so that it arrives to the newborn screening lab once it's returned to DCLS. Once the sample arrives at DCLS, the testing will begin, and barring any issues, the results will be available the following day. One thing to note, the courier visits the hospital 7 days a week. However, this testing will only take place at DCLS Monday through Friday. Samples received at DCLS on Saturday or Sunday will be tested on Monday. Once the testing is completed, the results you receive will either be cytomegalovirus DNA detected, or no cytomegalovirus DNA detected, or invalid. Invalid meaning the test should be repeated. We hope that we won't have many invalid results. However, we may have some. Repeat testing will be challenging as the baby is likely to be discharged from the hospital by the time the test result is received. And we currently have no mechanism for obtaining samples from a pediatrician's office. In these hopefully rare instances, the pediatrician may need to send the sample to a private laboratory for additional testing. There are also a few reasons why the specimen may be rejected. This rejection would likely take place before testing, but again, the baby may be discharged, so we hope that we can avoid rejections wherever possible. Rejections may occur due to holding time. In this event, the sample is older than 7 days when we receive it at the lab. They may occur due to temperature of the sample upon receipt. As mentioned earlier, if the sample isn't cold when we receive it, we will have to reject it. In addition, and this is also very important, this test is only valid for the first 21 days of the baby's life. So if the sample is taken after 21 days of life, the sample will be rejected. Of course, improper collection materials, sample leakage, or too much viral transport media can also lead to rejection. Okay, thanks for your time today, and please don't hesitate to reach out if you have questions or want to talk through the logistics or need any clarification. Thank you.
Thank you for that information, Liema. As we have previously mentioned, education and prevention methods are key components of implementing CMV screening. Virginia has developed several materials to provide education and guidance regarding cCMV screening. We will review a few today. This is a brochure that we will use for prenatal education and provides guidance on prevention tips in the prenatal period. These brochures will be distributed to women of childbearing age and women who are pregnant to increase education on cCMV. Recently, the Virginia EDDI program has updated the Your Baby's Hearing Results brochures. The updated brochures are result specific and are different colors to allow them to be easily differentiated. This is to ensure that families are provided with accurate and timely information for follow-up and next steps based on their individual child's results. Each family should receive the brochure based on the results of their final inpatient hearing test. All birthing facilities in the Commonwealth should have received the updated brochures by now, and they are also available on our website at www.vdhlivewell.com/EDDI. Pictured here is the brochure for those who would fail their initial hearing screen and thus would need to be screened for cCMV. This brochure will be distributed to birthing facilities in Virginia to provide families with next steps in education regarding CMV. This should be provided to families of children who were screened for cCMV at birth. This will also be available on our website and will be mailed to all birthing facilities. VDH, in conjunction with a subcommittee of the Virginia EDDI Advisory Committee, has worked to develop protocols for cCMV screening in Virginia. This guidance document will discuss best practices for implementing hearing-targeted cCMV screening and will be distributed to all stakeholders by mail and will also be available on our website. Each year, the Virginia EDDI program conducts an annual reporting form for hospitals to ensure that we have up-to-date and accurate information from birthing facilities. The 2020 annual reporting form will include information about cCMV screening in addition to the hearing screening. Please have someone at your birthing facility complete the 2020 annual reporting form by August 1st, 2020. This form can also be found on our website under the Professionals page. See this slide for the direct link. In addition, these hospital personnel who would need to obtain access to visits to enter information regarding cCMV screening, we ask that you complete the access form and send it to our shared email at va_eddy@vdh.virginia.gov by August 1st. We'll also provide our email address at the end of this presentation for those of you who need to jot it down. In August, during our third training of the series, we will provide in-depth training on how to utilize visits. So with cCMV implementation just a few months away, here is a quick recap on steps hospitals can take now. Each hospital should designate at minimum 2 hospital personnel as point of contacts for VDH regarding cCMV screening, and these staff should obtain access to visits by August 1st, 2020. Completed access forms should be mailed to the Virginia Eddy shared email, va_ehdi@vdh.virginia.gov. Each hospital should complete the hospital annual reporting form by August 1st, 2020. Hospitals should consider reviewing and developing internal policies regarding sample collection, storage, and transport. And each birthing facility should determine the need for additional resources prior to implementation of cCMV screening at your facility. If you have any questions regarding the information that was shared on today's webinar, please email us at va_ehdi@vdh.virginia.gov. Thank you for joining us today.